afternoon and thanks for joining us. I'm Judy Simpson. Our focus today is on your health and cancer. In partnership with the University of Vermont Cancer Center, we're able to share with you the latest information from some of the top cancer experts in the country. Today we're going to learn about bladder cancer with Dr. Mark Plant. Dr. Plant is the Division Chief of Urology at the UVM Medical Center and a UVM Cancer Center member. He's been with us before and it's a pleasure to have him back on the program. Welcome.
Thank you. Thanks so much for having me again.
Sure. Let's start off with an overview. How common is bladder cancer? Because I would imagine it's really not too much on the radar for a lot of people.
So it's interesting. Most of the time I come on the show, we talk about prostate and testicle cancer. In fact, bladder cancer is a fair amount more common than testicular cancer and not that less common than prostate cancer overall.
Really?
Yeah, more than 75,000 people are going to be diagnosed with bladder cancer this year. The majority of which are men, but it is certainly not an uncommon disease.
As a matter of fact, the statistics say it's the sixth most common cancer in the U.S. after lung, prostate, breast, colon cancer, and lymphoma.
Yes, and in fact it's the third most common cancer in men.
So tell me a little bit about what you see when folks come to you.
So in general, by far the #1 presenting symptom patients will come with is blood in the urine. So the one thing and one message I'm probably going to touch on several times is if anybody sees blood in their urine, they really should see their doctor. It is not something that we want to overlook. Bladder cancer is a disease that is certainly treatable and certainly curable in many, many cases. And the earlier we see patients and get treatment underway, the better the chances for cure.
Tell me a little bit about bladder cancer mortality rates. They're up in northern New England. Yeah,
so New England actually has for several decades now been seen as a little bit of a hotspot for bladder cancer. Several years back we participated in a study that was looking specifically what might be going on. And in fact, one of the things that came to light is it may be related to well water and arsenic in it. As you know, arsenic has been used as a pesticide in years past. And certainly arsenic is also used in pressure-treated wood. So it's in the environment. So one thing I say to my patients is make sure if you're on well water, consider having it tested as well as consider having filtration of some sort in place.
That's kind of scary.
I don't want to scare the viewers. I want to empower them and with the idea of, you know, yes, bladder cancer seems to be more common in New England. It's not rip-roaring in terms of its commonality, but it is something to think about. And again, if you're on well water, there are resources to have it tested.
So what's the one thing you really want people to know about bladder cancer?
I so appreciate that question. If there is one message, smoking and bladder cancer are related, and they're related intimately. So when patients ask me, what's the #1 risk for bladder cancer? I say it's smoking. And then I actually go on to say the #2 risk is smoking. The #3 risk is smoking. Just to try and set in stone that I know we know smoking and lung cancer are associated, but smoking and bladder cancer are intimately related. And really it's a message I want to send to young people.
That's really something that we don't hear. I mean, there are warning labels on cigarettes for lung cancer.
You're right. We have not, and again, my thanks to you and WCAX for allowing us to send this message. We don't communicate well enough that smoking is related to other diseases. And I know I'm going to sound like the old school physician and talk about how you have to quit smoking, but I want to do it in knowledge. And the clear knowledge is smoking is by far the #1 cause of bladder cancer today.
Let's talk about some of the details. What exactly is bladder cancer?
So speaking to the bladder in general, the bladder is actually the organ that allows us to store and then empty urine on demand. So what happens is the bladder is lined by a mucosa or cells, and we call those transitional cells. So bladder cancer is actually, and by far the most common, is those cells starting to divide abnormally. So you create tumors of the transitional cells, and we call that transitional cell carcinoma.
And so there's another kind too?
There are actually other kinds. They're less common. The other kinds are squamous cell carcinoma, which is typically more of a disease in the Middle East related to an infectious agent or infectious organism called schistosomiasis.
Okay.
May as well add in some big words. And the other is adenocarcinoma that is more related to patients that might have a catheter in for long periods of time.
Now, you pointed out that we don't fully understand why someone gets bladder cancer, but there are risk factors, and once again, smoking is at the top of the list.
Absolutely, without question. And again, I'll be the pain in the rear. Smoking by far is the #1 cause, and especially for young people. I know that smoking may be something that it feels and seems to be the right thing to do. I would implore them, there are many better things to do for your health than smoke. Just touching on some of the other things that may cause bladder cancer, it used to be before industrial, how might we say, regulations and safety measures were put into place, chemical exposure was an issue. Chronic inflammation, I've touched on if someone has a catheter in for a long time. Sadly, something I'm suffering from, age. As we get older, the bladder, it's felt, as it gets more exposed to urine over more years, it's more susceptible to bladder cancer. Gender, again, men are more predisposed to bladder cancer than women. Caucasians are more predisposed. And lastly, there is some suggestion that there's an association with family history. And actually, this is a good time to touch on why might that be. And it probably has to do with secondhand smoke exposure.
Interesting. So not only for the smoke themselves, but anybody who's been around them.
Correct.
I want to just back up a little bit and talk a little bit about workplace exposures, because you mentioned chemicals, but also under that umbrella is hairdressing supplies and paint. Yeah,
so we typically talk about benzenes or solvents. Again, I don't want to create too much fear. You would have to probably be under a hood with spray paint or hairspray for some extended periods of time to really have an increased exposure risk.
So it's okay to paint the living room.
It is certainly fine to paint the living room.
Okay. So we can't control family history, but there are some specific things we can do as individuals to reduce our risk to getting bladder cancer?
Yep, so certainly there are some things. It really, oftentimes patients ask me, no matter what kind of cancer, what can they do to help their cancer status? I have to tell you, it really comes down to heart and overall general health. Healthy is cancer healthy. So low fat, high fiber diets, lots of activity, lots of fluid intake, and fluids being good fluids, of course, waters, juices. In general, we have to be mindful that a healthy lifestyle has many benefits in our lives, and not just necessarily our hearts, but also our potential risk for cancer or how we do with the cancer we may be diagnosed with.
Is it ever too late to adopt those kinds of habits?
I don't think so, although I'd love to say I'm perfect, but I am not. But it is never too late. And I think the other benefit is, as we all know, when we're active and we're exercising regularly, I think most people know they feel better.
So let's talk a little bit too about some of the symptoms or warning signs to be aware of.
Yeah, so it's important to know that blood in the urine, again, by far the most common reason someone might be brought on to the idea that they may have bladder cancer. There are other signs and symptoms. So if someone feels that they're certainly having a trend towards peeing more often, that could be a sign and symptom. Pain with urination is another. If they have any back pain or pelvic pain, again, those are symptoms. I want to be careful though. Blood in the urine is really the one to stick in people's minds. The other symptoms are important to be discussed with their doctor, but there are a lot of other causes of the other 4 symptoms that I'm talking about that aren't bladder cancer. Again, really, blood in the urine is the central concern.
And obviously, the sooner you're seen, the better. I mean, once there's blood in the urine, does that mean it's full-blown cancer?
No. So, and actually there are other causes. Actually, I should be clear. The most common causes of blood in the urine for both men and women are not bladder cancer. So there are other reasons why you might have blood in the urine. But we should figure out why, because bladder cancer could be one of them. And if you have blood in the urine, it does not mean it's full-blown. In fact, to touch on bladder cancer in the big picture, most cases of bladder cancer can be managed locally, so we don't have to, and I hate to be graphic, but we don't have to cut anyone open to remove the tumor. So many of the tumors can be just, removed and managed and handled through natural orifices.
Okay. Do you find that patients don't often talk about this issue, don't even bring it up to their doctor sometimes? If, you know, you're sitting in the exam room, oh, they're really blood, no, I'm fine.
Yeah, so and you know, I think it's incumbent on my profession to make patients feel more comfortable. So again, I'm not perfect, but I need to always remind myself to make sure I'm at my best to listen to what they're saying. And yeah, it's not a comfortable situation to go to your doctor and start, you know, how we urinate tends to be something that's a little bit personal. But you know, in general, our job is taking care of patients. Well,
how can patients make your job easier? Because we bear a responsibility too for our health.
I agree. I mean, certainly we as individuals do have a responsibility to our health. I think it would be to make sure that, you know, for instance, you have blood in your urine. When you see your physician, make sure, you know, and maybe good old Dr. Mark is distracted. Hey, Mark, I need to remind you, I actually saw blood in my urine. That would be the easiest thing. If you have blood in your urine and your physician seems to not have heard, feel free to tell him again and blame it on me.
Well, once someone's diagnosed with bladder cancer, what's the prognosis?
So in general, again, most of the cases can be taken care of by simpler surgeries. So in general, the prognosis is quite good. However, there are such things as aggressive, locally advanced, or invasive, and, you know, how might we say, tumors that require more than just simpler surgeries. The good news is the more tumors we find earlier, the less we have to get into the later stage or more aggressive treatments.
Is it usually just one tumor, or if there's one, there are usually more?
Another great question. In fact, not uncommonly, bladder cancer can be multicentric or multiple places in the bladder. So what I talk about is it's akin to dandelions on a lawn, something else I suffer from. And so you might have a dandelion in one part of the lawn, but not infrequently you'll have it somewhere else.
Right.
And so typically what you got to do is get rid of the dandelions, being the tumors, but the dandelions can come back. So again, it's not only just getting rid of the tumors, it's just making sure that they don't come back.
So you've mentioned smoking a couple of different times in the past 10 minutes. For those who want to quit smoking or have tried and have failed, is there help?
There absolutely is. And you know, I think we're all witness to being in a state that promotes healthy living. We certainly have an environment that is keyed into it entirely. And Vermont has among the most robust smoking cessation programs. So I would certainly say people should not feel that they're alone, and it is not a stigma, and it's not something to be ashamed of. It really is something that it's not doctors wanting to sound like old curmudgeons. We want to improve the health of our population and our, you know, of our community. So there's a website, there's a number. Family doctors certainly have great resources. Even the University of Vermont Health Center has, how might we say, resources available.
One more thing I want to ask you about. The Cancer Center is putting together its second annual Men's Health and Cancer Conference. Tell me a little bit about that. Yeah,
so actually this is now going to be an annual conference that has a range of topics related to men's health, ranging from nutrition, men's cancers. It's headed by one of our faculty, Dr. Scott Parapato. And, you know, he's put another robust program together. It's free and available to the community for those who would like to attend. The details are on the screen. And certainly feel free to phone the Division of Urology at the University of Vermont Medical Center so that we can key you into when it is and how to get there.
And it's not only a men's health and cancer conference, but it's also for women who love their men.
Absolutely. So I want to be careful. It is not certainly genderification. It's more, let's talk about cancers that affect men, but there are also certain topics that lend themselves to both men and women, and certainly we men appreciate, well, I always say to patients who come with their wives, I think of the wives as the truth serum and the conscience of the male patient.
Mark, thanks so much for joining us today.
Thank you so much.
That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.